California. You will have the opportunity to ask questions at the end, and then I will hand over to now. Thank you.
Thank you. I think the next slide is for the Advisory Council. Yes. So I'm Andy Imperato. I am Senator Harkin's former Disability Policy Director, so I've been at all the Harkin summits, and it's great to be here in Belfast, which is twice as large as any of the summits we've had so far, so we're really grateful for the turnout. This is going to be informal. One of the hats that I wear is I serve on the National Disability Advisory Council for Centene. Centene is a giant corporation that most people have never heard of. They're based in St. Louis. You'll get more details on them later. They're a healthcare company that has grown exponentially in the last 30 years under the leadership of Michael Neidorff, who was the CEO who passed just recently, just a few months ago. And this advisory council that I serve on was something that Michael created about 10 years ago. And his concept was that the core business of Centene depends on deep knowledge of people with disabilities as healthcare consumers, as employees, and he wanted to bring together outside independent people to tell Centene basically how to do a good job serving the disability community as a market, how to engage with policymakers alongside the disability community to try to create better policy, how to do a good job as an employer of people with disabilities, and how to have strategic partnerships in the community with people with disabilities. In the United States, our healthcare system is a combination of public and private leadership, where our biggest public healthcare system, Medicaid, ends up contracting with private sector companies like Centene to provide services to people with disabilities and other vulnerable populations. So because of the nature of their business, Centene is definitely interacting with the government on a regular basis. They're interacting with stakeholders on a regular basis, and they're competing with other for-profit companies for contracts, and their competitors are also trying to build these relationships with the disability community. So what we really wanted to talk about with you all today is, as we look at Senator Harkin's goal of doubling disability employment over 10 years, is there a way that corporations, Centene is, I think, Fortune 26, like one of the largest corporations in the world, is there a way, or in the United States, is there a way that corporations can partner with the disability community so that they're more successful as a business, they're building deeper knowledge of the disability community and what our priorities are and how we want to be served in a healthcare setting and in other settings, and they can beat out the competition to be, the most successful healthcare company in the United States. And I think one of the unique things about this partnership, our advisory council meets 3 times a year in St. Louis when it's not COVID, and we, at least once a year, we spend an hour with the CEO of the company. And it was not a scripted thing where, everybody had to see what our questions were or see, what we were going to push them on. They really wanted us to be independent. The CEO wanted us to be independent, and they wanted us to push him. One of the things we pushed him on was trying to get disabled people on his board of directors, because we thought that was important. He had a small board, and obviously the board of directors of a company matters a lot. That's obviously something that the Valuable 500 has been pushing as well. So I have with me today Erica McConduit, who is the Chief Diversity Officer for Centene. She's based in New Orleans, used to be the head of the Urban League in Louisiana, strong background in civil rights, equity, social justice. Sarah Triano drives a lot of disability strategy for Centene. She has a background working in disability rights, including running an independent living center in Silicon Valley and working in state government in California before joining Centene. And Patty Barnett leads health policy advocacy for Centene. She's based in St. Louis, but a lot of her work happens in capitals across the country and in the United States capital. And she spent 10 years working with the White House, multiple administrations on health policy, including in the Obama administration. So I think I'm going to stop there. I'm really looking forward to the Q&A, and we're all going to be pretty brief. so that we have time, and we're going to try to get us back on time. But thanks for joining us. Over to Erica.
Good morning, right? Are we still in morning? So as Andy said, I'm Erica McConduit. I have the privilege of leading diversity, equity, and inclusion at Centene. But I don't come from a traditional corporate America background. As he said, I feel like I'm an advocate at heart. I have the good fortune of being the previous CEO of the Urban League of Louisiana, where I spent 10 years really in civil rights advocacy. Did a lot in terms of state government, a lot of work on the local level, but really it is about establishing partnerships. I worked on the table, right, as an advocate, working with companies, looking, quite honestly, for companies to partner with, who really sincerely cared about the community and the most vulnerable populations. After 10 years, I felt like, well, you know what? It's really time for people like me who are severely underrepresented in corporate America as a Black woman, right? We are not in leadership positions in corporate America. What would it look like if I challenged myself to come back into the corporate sector and make a difference? And so I found a company, as Andy said, our prior CEO, Michael Neidorff, was a strong advocate for the most vulnerable populations. He actually served as the board chairman of the National Urban League, which is one of the largest, oldest civil rights organizations in the company. And so in my role as an advocate, I got a chance to see those companies who really cared. And so I decided to come to Centene, and I'll tell you a little bit about it. I wanted to give you my backstory, but it was important for me to choose a company in corporate America where I felt like my be valued in such a way that they could really drive change. So when I entered Centene, I really came with a strong agenda. I told them, listen, when I was hired, I told them, you are hiring an advocate. And advocates push, you know? And so I went there with that in mind. Centene, as Andy said, is a really big company. Not many people have heard of Centene. You might have heard of perhaps one of our local market health plans because we take a very localized approach. But our corporate entity is Centene. As Andy said, it's a Fortune 26, so a very big company. And according to Fortune, we are one of the world's most admired companies. And I'd like to think that we do that very intentionally. We are headquartered in St. Louis. We have about 70,000 employees across the country. We're located in all 50 states and 3 international markets as well. What else can I say about Centene? As Andy said, we are the largest managed care organization, so certainly Medicaid, Medicare, Marketplace. I like to tell people in layman's terms, if it's anything in healthcare, we do it, right? Vision, dental, traditional, behavioral, physical healthcare, we provide it. So that's who we are at Centene. But I think more importantly, to disability inclusion is certainly about who we are as a company, but how do we impact it also for the members we serve? So we look a lot at employee inclusion. So Centene should be comfortable bringing their unique selves to work. We heard a lot about that this morning. So every year we launch an annual campaign. And a few years ago, we rebranded it. We took a fresh look to say, how do we get more people to self-identify? Because we know there's a lot of stigma about coming forward for just whatever fear may exist in the workplace. And so we rebranded and relaunched the I Count, Why I Self-Identify campaign. And literally, over the last 3 to 5 years, we went from having a self-identification of 3% roughly to now 10% of our workforce identifies as having a disability. Now, if you know anything about corporate America, you'll know that that is a significant accomplishment to jump that much in such a short period of time, but we did that through a number of ways. That we did that certainly by looking at we recruit, right? How we bring people into the workplace, but then once you bring them in, what do they come into, right? Is it a welcoming environment? Do they have equal opportunity to succeed at Centene? Are we providing the right tools and resources so that they can be their best selves at work, right? That they can accomplish just as much as their peers and counterparts. So we have done a lot of work. We stood up a dedicated accessibility office within Centene. That's another initiative just 3 years ago we undertook to create a dedicated office at Centene. We serve and respond to about 600 accommodation requests each month. So if you think about it, we have 70,000 people and we are managing 600 requests on a monthly basis, right? That's a lot, and that's fantastic, but we can't rest on our laurels, so we know we heard, oh, we'll get to 15%. We're like, okay, lots of work to do. Ability here, our internal employee inclusion group. If you know anything about employee resource groups or business resource groups, the companies call them all sorts of things. We have our employee inclusion group. We really lean on this dedicated group within the company to help advise us, right? Advise us on what we can do to make your experience at Centene more rich and equal with everyone else in the company. And so they do a lot internally, but we also use them to help with our external partnerships. And so it is about who gets the ability to do business with Centene. So part of what our Ability Resource Group does is they help to certify disability-owned businesses, right? And that's important to us because the more we can think about who we intentionally provide business opportunities to, we know that also makes a true difference in the communities that we serve. And so we judge ourselves, we try to make sure that we are best in class. So on the bottom of this screen, you'll see we participate in a number of benchmark surveys to make sure that we are continuing to grow and to push ourselves. So we're really proud of being a best place to work for disability and inclusion by the Disability Equality Index and the National Organization on Disability. We are known as a leading disability employer. And again, we do a lot of work to make sure that we're continuing to be best in class in corporate America. And I'm going to turn it over. I'll answer more questions about what we do internally in terms of our pipeline and promotions and things like that if we want to have that discussion, but I want to make sure to give my colleagues some time. So I'm going to turn it over to Sarah.
Thank you, Erica. So I have to just take a moment and say how incredibly excited I am to be, yes, in Ireland, but in the undisputed redhead capital of the world. Seriously, like you have no idea. I went to South Korea to speak on behalf of Marco Bristow in 2012, and I had people literally like stopping me in the street, taking pictures of me, because I was the only real redhead in the entire country. And it's not that much different in the United States, actually. I go into a meeting and I'm the only one in the room. But thanks to Erica and her efforts, I am not the only disabled employee at Centene. Yay! But Erica, we gotta work on that redhead thing. It's definitely a problem. So I was born without the antibodies that fight off bacterial infections, but most of my actual functional impairments, no, it's not from being a redhead. That comes from living with bipolar and obsessive compulsive disorder my whole life. And if I had a nickel for every time somebody said to me, you don't look disabled, right? So now when they say to me, gee, Sarah, you don't look disabled, I just look at them and I say, yeah, well, gee, you don't look ignorant. So there are many, many barriers to employment for people with my disabilities. But based on my own experience, I would argue that the single greatest barrier to employment, at least in the United States for people with disabilities, is healthcare. When I was just 6 months shy of defending my dissertation and earning my PhD, the university that I was at denied me health insurance on the basis of a pre-existing condition. which forced me to drop out of school and to take a job full-time at one of the only employers in the area at the time that had a health insurance plan that would cover me, which was a Center for Independent Living. I went to work for Marco Bristow at Access Living. But that nexus between, health insurance and disability employment, that wasn't new to me. Because when I was a child, my parents tried to get me health insurance through a private insurance company, and I was denied health insurance because of my pre-existing conditions. But then when they tried to get me health insurance through the public health insurance in the United States, in order to do that, we had to swear to the federal government under oath that I could not work because of my disability, which unfortunately, to the chagrin of my parents, I wouldn't do because I have OCD. I wouldn't lie. And so my parents had to work, both of them had to work 2 jobs just to pay for my medical bills growing up. But it isn't just me that's been impacted by this intersection between healthcare and employment. There was a study in the Journal of Disability and Health that 2/3 of people with disabilities in California who wanted to work and were not working said that they weren't working because of their disability. But when the researchers probed further and said, well, why do you think you can't work because you have a disability? 97% of them said because a healthcare professional told me I couldn't work because of my disability. But I didn't need this kind of research to tell me this. I had experienced it personally. In 2012, I had a mental breakdown and had to stop working for a short period of time. And about 5 months into my recovery, I was feeling better. I told my psychiatrist, I want to go back to work. I'm ready to go back to work. And she said, no, I really, really think that you need to consider going on long-term disability and exiting the labor force. And I told her, I said, no, I really want to work, and I'm being considered for an appointment by the governor of California, so I need to get back to work. She turned to the nurse in the room and she said, we better check her medication levels because I think she might be hallucinating. So the private and public health insurance system in the United States is set up to actively discourage disabled people from working. And the predominant message that's coming from our doctors to us, most of whom do not have disabilities, is also that we can't work, and if we could, we shouldn't. So Andy, Patty, Erica, and our Centene National Disability Advisory Council and I, we said, what would happen if we flipped that script? What would happen if a major Fortune 550 healthcare company started actively telling the disabled people that we serve that they can work instead of that they can't? And when Centene's health plan in Kansas did that, the results were nothing short of amazing. So today, our health plan there in Kansas and their local disability employment partners boast a 71% competitive integrated employment job placement rate among our members with disabilities who have received long-term services and supports. And in addition, the healthcare costs for that plan's members with disabilities who are working and participating in the buy-in program that Patty's going to tell you about a little bit in just a minute are less than those for our members with disabilities who are not working. And in the instance of folks with developmental disabilities, it's about 40% less. Their LTSS costs, long-term services and supports costs, are about 40% less. So based on the success that we had in Kansas, and then there was a study done in 2019, it was a survey of people with disabilities in managed care across the United States. And it showed that only 3% of them were working, but 24% of them wanted to work. But 78% had not had somebody even ask them, do you want to work, and educate them about their ability to work. So we launched a nationwide, we call it the Just Ask campaign. And the premise of the campaign, again, is that instead of assuming that the people with disabilities we're serving can't work, we assume they can, and we ask all 350,000 of the people with disabilities who are receiving long-term services and supports if they want to work. If they do, we're educating them about their ability to work, and we're referring them. But it's not good enough to just refer somebody, right, to an employment agency, because then you don't know if they actually work. You don't know the quality of the services that they get, and we don't know if their decrease in cost is actually because they're working. So we're actively working in partnership right now with the Social Security Administration and with Centene on becoming the nation's first health insurance company that is a national administrative employment network. Now that may ruffle some feathers because we aren't staying in our swim lane, but if staying in our swim lane means the status quo as far as disability employment is concerned, then forget it. Everyone's invited to our pool party, thank you. So, oh, sorry, there's that fiery redhead again. I totally blame Andy. This is what you get, Andy, when you put me in a place with a ton of redheads and a lot of my fellow disabled people. Empowerment. So speaking of empowerment, and Andy, if Centene didn't have Andy in our National Disability Advisory Council, we wouldn't be doing this work. We absolutely wouldn't. This is a priority just because we have folks with disabilities meeting with high levels in our corporation and who are advising us on what to do. So to tell you more though about our leadership in the Medicaid buy-in space and advancing policies that support disability employment, let me turn it over to Patty.
Thank you, Sarah, and it's just an honor to be here. Like Erica, I carefully chose Centene because of its reach, of its across so many of the states in the United States, and I left a front row seat in policymaking to make a difference. And what I've learned is that with the help of all of these amazing people, and I'm just so honored not only to be with all of you, but be on the stage with them, Centene has the ability to really shape policy at a state level and in a way that I didn't have access to when I was at the White House. So I'm excited to tell you and focus on our public policy efforts. So one thing I really want to focus on is what we are doing across the United States, across states and the federal government, in addressing what we believe is one of the fundamental policy barriers to work, and that's access to health care. Before I get into solutions, and there are solutions, I want to really talk to you about the policy problem. So you heard from Sarah that persons with disabilities are hearing from their providers, they're hearing from government offices, don't work, you can't work. And that's, that is grounded in a lot of what we've been talking about today, stigma, culture, but it is also based on a fundamental fear of losing access to critical benefits, being in disability income, and also access to Medicaid, which is the government's low-income program that really is a predominant coverage for people with disabilities. So the thing about Medicaid, it is, as I mentioned, really the only source of long-term services and supports. You cannot get that access with an employer or any other private coverage, so it's really critical. And because Medicaid's income limits are so low, it really creates a disincentive. And you know what, I'm gonna just, really the best way to describe it is this quote, and I'm gonna read it to you, which just really breaks my heart. I'm young and ambitious to make an impact on the world, but I'm extremely limited on what I can do due to the fear of losing my medical benefits. I just graduated from college and I'm eager to get a job in my field, but I've been told by someone at my local Medicaid office that if I make over $1,500 a month, I will lose my health insurance. So that is a real fear and is really driving people to sit on the sidelines and to earn less and to achieve less and to dream less, and that's not right. But all is not lost. There are solutions, and that is what we are here to promote, and I think ultimately want to end with getting your help on this, because it's really going to be a collective effort. So the problem is, as I mentioned, that income and assets are so low that it really inhibits people from dreaming big. But there is authority in the federal government for states to increase or even eliminate income and asset limits for people with disabilities so they can work. In fact, 45 states have programs in place called Medicaid buy-in. Sometimes it's called Medicaid for Workers with Disabilities. The buy-in moniker comes in because some states require a premium, but 45 states have these programs. But take-up remains really low because even in some of those programs, the income asset limits, while higher, aren't high enough. And also, there are age limits unnecessarily. Some states are confused and don't believe they have the ability to go above age 65. And we all know that people are working longer and they need that ability. So the other big barrier is that eligibility workers across the states aren't really familiar with this program. So all these forces kind of come together to make take-up pretty low. But as I mentioned, the solution is states don't have to have income and asset limits. They can either greatly increase it or do away with it altogether. So we are working across our states to really strengthen these programs. And we believe it's a win-win for everyone. So for the states, and you might have seen that on Sarah's slides, we see that for people who are currently enrolled in the program, if they participate in this Medicaid for Workers with Disabilities program and can get a job, they tend to have lower Medicaid costs because chances are when they get a job, they might have access to an employer offer of coverage. The employer pays for most of the medical benefits, and then Medicaid wraps around with those critical long-term services and supports. So states can actually see decreased cost on their end. Further, we know that there's a real fear, especially in more conservative states, that if they do away with income and asset limits, that it's the caseloads or the enrollment's going to balloon. We don't see that. We do not see because a lot of people with disabilities are already on the program. So we don't see a huge influx. We believe that it'll be a modest increase for states to do this. And the thing that we would love and we dream of is having more people participate in this program to study the longer-term macroeconomic. We would all argue that the more people are engaged in the economy and longer-term, the higher the tax base, the better the macroeconomic benefit. So I challenge all of us to do more study and data and analysis of that impact. The other thing is employers win because that key barrier is taken away, so their ability to retain and attract more workers will occur. And then lastly, I don't need to say just how impactful it will be for persons with disabilities who can actually dream big and dream of earning more and not worrying about losing their critical healthcare benefits. So I will leave you with a call to action. We believe it is a really important time for the advocacy community, for employers, for corporate America, for nonprofit groups to come together to work across the United States and globally to address this key barrier. And I think there's just some things that states can do already. So I think it's educating states that they have the ability to remove this barrier. And also I think it's working with the federal government because they haven't produced guidance and regulations on this pathway in 20 years. So I think there's a real leadership opportunity at the federal level to educate and support. So I will end with a call to action. We'd love your help. We want your partnership. And we will, I think we'll end here and take your questions. Thank you.
Thank you so much. We are running a bit close to time, but we'll maybe have time to take a quick question or two if that's okay. So, your hand. Yes.
I'm Jenny Driscoll and I work for the Department of Work and Pensions, so we're, obviously the team I work with is very much about challenging employers to, open up opportunities. And obviously we're looking at policies that are important to the government, but it's really, something that we can to open doors so that you're actually getting employers to sort of, not think about barriers, but think about more about opportunities.
So, was it on? So I think for us, it really comes down to, in healthcare, we approached it to say, okay, like, this is who we serve, right? This is the way of the world. This is the population that we serve. So how do we step up as a leading employer in healthcare, right? To say that if we can show the benefits of having a more diverse workforce, then perhaps we can lean on our colleagues and do things like join the Valuable 500, right, which is an incredible network, which we did under the leadership of our previous CEO. How do we bring in additional external experts, which I think also is very helpful to corporations to hear external advisors tell us, listen, this is how you can do it. This is the impact that you can make. These are the tangible benefits. And so we said, well, let us be a test case, right? We will take this challenge on and share our story so that people can see the types of progress that we've made both internally with our workforce, externally with our members, and then our policymakers, right? Like now it's time for us to take it to the next level and lean on policymakers to say, let us set the right environment overall so that it makes it a win-win situation for everyone across the board. One thing I'll also say is there are very, low-hanging fruit also, because sometimes people need to see quick wins. And so when our SINDEC Advisory Council told us, you know what, why don't we launch a project, a provider accessibility initiative, right? That says, you know what, you're healthcare insurance, but you actually don't provide the health care, you provide the coverage, right? So how do we make the experience for your member base more rich and welcoming and inclusive when they go to see the providers in your network? And so can you create a fund that providers can access to make their actual locations and their offices more accessible and inclusive to the member population, particularly our individuals with disabilities? Because like that slide that we saw earlier, the cartoon, if you clear the snow for people with disabilities, you make it clear, you make the ramp clear for everyone, right? And so those are quick wins that I think are important for companies to see. For us, it was important for us to see that we can empower our providers, right? That's how we actually deliver care in communities through our provider network. Can we lean and create access for providers to create more access for the members that we serve? That's a win, a quick win for us as a company. So I think it's important for other companies to identify those areas that are aligned with their business, to have the quick wins, and then you continue to build from there.
And if I can just add, I think some of the elements that made it work at Centene, one is you had a CEO who had a personal commitment and was willing to spend time and budget on this as a priority. And it was never framed exclusively as, this is our core value, this is who we are. That's certainly part of it. But it was also, this is how we're going to be successful as a business. And their business, the people in their business that they can make the most difference financially are people that have high healthcare costs, which are people with disabilities. So the deeper their relationship with our community, the deeper their understanding of the community, the more likely they are to be successful in a very competitive marketplace. So I think if you can get beyond it's the right thing to do, which is a good motivation, but really tie it to business success, then I think it's going to be more solid, especially when there's an economic downturn.
I don't think we've time. I'm so sorry. We don't have time for any more questions. Apologies. Anyone wants to, if you can find. Thank you so much. Apologies for rushing at the end. That's the end of this session. The presentation will be available on the website, the app and virtual platform within the next few days. Thank you to the team from Centene and Andy. Extremely informative and really useful to listen to today, so thank you so much. If you'd all just like to move on to your next session, and I hope you all enjoy the rest of the conference today as well.
Hello? Yes, they are, but I doesn't, they were like,
Hi, how are you? I'm Joanne. Hi. Are you Ashley? Hi. I'm Joanne and this is Kirsty. We're just hosting. Beautiful. You sent your presentation.
I did, yes, I was.
We have research that supports not only college, not enough, you know, and I think it's a good conversation how I don't think the vision is based on grounded in nature, the benefits of informing for the decision themselves. And Sarah said the biggest barrier to employment is access to healthcare. I don't agree with that. I think the biggest barrier.
Do you want, are you happy? It's probably easier for you to do it than me to change your notes. Is there anything else you want?